Iraq inquiry because of the devastating impact that war can have on health. It seems to be clear from the initial reports on the inquiry's outcomes that not all peaceful solutions were tried before the rush to war. This has had devastating impacts on the people of Iraq who have suffered a massive health catastrophe. Medact will continue to campaign for peace because of the intrinsic link between health and peace. Those that live at peace can therefore live healthier, more fulfilling lives, and Medact is committed to fighting for that peace.
My name's Ben Griffin and I'm from an organisation called Veterans for Peace UK. We have been stood here today because behind me in the QE2 Centre, the establishment has published what's become known as the Chilcot Inquiry Report, which is a long, 2 million word report that is the establishment version of events around the build-up to war, the attack, the invasion and the occupation of Iraq. I think what we're seeing today is a focus on just one of the many wars that Britain has been involved in. In 2003 it's beyond doubt that this country and our armed forces carried out an illegal invasion of a sovereign country, Iraq, that amounted to a war of aggression. Following that invasion, in a joint enterprise with the United States of America, we conducted an occupation during which the Geneva Convention was breached on hundreds, if not thousands, of occasions. And that is what this report has been looking into. Whether they have uncovered any of this is open to question. Most of the people who have been interviewed have been high-level generals, heads of intelligence services, MPs, media people, but they haven't actually interviewed any of the soldiers who were on the ground at the time. And I think it's important that the British people understand how brutal those attacks and invasions and occupations were, how many people suffered, not just 179 British troops, but thousands, tens of thousands of Iraqis lost their lives, hundreds of thousands of people were injured, both physically and psychologically, hundreds of thousands of people were turned into refugees, homes were destroyed, infrastructure destroyed, and the country has been in a state of conflict ever since, and that is our responsibility. But let's not just focus on Iraq, because that's what the establishment would like us to do. They'd like us to think that Iraq was this one-off war that we fought, this one bad war. But look what we've done since the invasion. In 2006, the British Army invaded Afghanistan. Again, we sent 10,000 troops into Helmand province. The Defence Secretary at the time, Reid, said that not a shot would be fired. Within 6 months we'd run out of ammunition, we'd fired so much ammunition. Hundreds of British soldiers were killed in that conflict, hundreds were seriously injured, hundreds more psychologically injured, and thousands of Afghans lost their life in Helmand province. Thousands more were injured. So let's not forget about that conflict. And since then, we have also carried out a brutal air attack on a sovereign country, Libya. We smashed that country into pieces, and we have now left it for radical Islamist insurgents to take over. Imagine living as a civilian in that country now, what it must be like. We have re-invaded Iraq. We're now carrying out bombing missions on a daily basis in Iraq. We're carrying out bombing missions in Syria, and whilst we speak, British armaments companies, British military personnel, British intelligence personnel, British politicians are aiding and abetting the Saudi Arabian government in their brutal attack of the Yemen, where thousands, maybe tens of thousands of civilians have lost their lives and been injured. So Iraq wasn't a one-off. In fact, it's business as usual. And when is there going to be an inquiry into Helmand? When will there be an inquiry into Libya? We're not going to see it. And I think as health professionals, sometimes can focus on just what's going on in this country, how the NHS is being affected, the pressures you're under. I work in the NHS, I understand those pressures, but let's have a more global approach. Let's have a look at the health prospects of civilians in Iraq. The health prospects for them, on the receiving end of a brutal invasion and occupation. Let's look at the health prospects of people in Libya. Let's look at the health prospects of people in Syria. And let's not also forget that our aggressive military action has also led to probably the largest refugee crisis since the Second World War. And so I think it's important as health professionals that we look at a global perspective on this, and I would invite you to come and join the struggle to bring down the war system in this country. This United Kingdom, one of the most violent unions that's ever existed, I think it's a case or a fact that we've actually invaded every single country in the world bar 22, and I don't think anyone else comes close to that record. Join the struggle, let's bring down the war system.